Between 2007 and 2011, investigators found that Medicare paid an extra $7 million, giving second vaccinations to some seniors for pneumonia. One vaccination for pneumonia is going to be enough, but this was an instance where Medicare paid out for multiple vaccinations even when they weren't needed. The troubling part that investigators said is that a lot of these seniors were vaccinated by the exact same person both times. So it really should be on that person to check the medical records and realize that they themselves have already vaccinated this senior. Investigators at the Health and Human Services Office of Inspector General also said there's the potential for waste with medical airway equipment for seniors, and they said that the equipment is getting replaced more often than it should. Medicare is paying unnecessarily to replace this equipment before it wears out. They said that the equipment is a lot more durable than people seem to realize, and that beneficiaries can go a longer period of time with the same equipment. Investigators compared Medicare to state programs. They found that Medicare replaces the equipment more often than about 40% of state programs, and at the same rate as about 50% of state programs. The difference is that a lot of those state programs are now trying to change, trying to make replacement of the equipment more infrequent and let patients use the equipment for longer. The Inspector General recommended that the federal government also increase the time between replacement of the airway medical equipment, but officials at the Centers for Medicare and Medicaid Services disagreed. They said that increasing the interval between replacement of the equipment would make seniors vulnerable to fraud by the companies that produce the equipment, and they also were concerned about patients who aren't on a regular schedule of therapy and how it might affect them not getting the supplies they need in a timely manner.